I need your advice as to what I should do regarding my estrogen level. What's up, TRT community? Let's help each other. I'm glad that you're here. Listen, there's a question I get a lot, and it's, what's your testosterone level? What's your estrogen level? I get that question all the time. We're going to talk about that in this video today. And that's actually something that I need your help with in this video. I need your advice as to what I should do regarding my estrogen level. Before we do that though, this video is sponsored by LetsGetChecked. They help keep the lights on around here. More about them at the end of the video. They've got a special promotion going on, so stick around for that. You know that I'm not a huge proponent of using an AI. What is that? An aromatase inhibitor, an estrogen blocker. It's just simply, in my mind, an add-on. It's just been something that I didn't feel that I needed, especially when I know that I could control my estrogen level by only injecting exactly the right amount of testosterone that I need. Why? How? The more testosterone you inject, if you've got a surplus in your body will aromatase that extra testosterone and turn it into estrogen. So that's why that's called an aromatase inhibitor. It keeps that from happening. And so I might need to get on one, I don't know. So I went into the doctor recently and I got my blood work done, and this was the visit where he checks both testosterone and estrogen, and here's the phone call of me getting those numbers.
Yeah, the testosterone was 857, so he said it's just a mild elevation. It's supposed to be between 240 and 850. And then your estradiol level, he said elevated, need to go back on the estrogen blocker.
Okay, and what was that level?
It was 47.3.
47.3, okay.
Yeah,
Okay.
that was it.
Very good, thank you so much.
You're welcome. You have a good day.
You too, bye-bye.
All right, bye-bye.
So that's my testosterone level, and that's my estrogen level. Roughly a year ago, the last time we checked my testosterone, or maybe it was 6 months ago, I forget, my testosterone was hanging around 600 something. So there's always somebody in the comments that mentions that I don't inject enough testosterone. I only inject around 80 to 90 milligrams a week, but I split it up. I inject towards the beginning of the week and then towards the middle end of the week, 40 and 40, or maybe 45 and 45. That person usually says,
dude, you're not even injecting enough to even do anything or even feel the effects. What are you even doing?
well, usually that person is someone, not always, but usually that person is someone who is injecting testosterone for muscle gain, I think, because, granted, I'm at the lower end of what I inject. I know most of you inject more than that. Most of you do, right? But what I found is that amount works for me. And so, again, I'm just trying to feel normal again. I'm trying to keep my negative symptoms away. And so that amount keeps my negative symptoms away and also keeps my estrogen from getting too high and my red blood cell count from getting too high. Because that can be two things that you might struggle with if you're on TRT. Your red blood cell count might go up too much. Some people call that blood thickening. That's where the scare of a stroke and heart problems comes from. Whenever you might hear someone talk about, should I get on TRT? I don't want to have a stroke and I don't want to have a heart attack and things like that. Well, usually the guys who are injecting a lot, like a lot more than they should, they're the ones that will struggle with blood thickening. Also, guys who inject more than what's needed will also struggle with having their estrogen too high. So I did a survey. How many of you use an AI? And here's the results. You see that most of you don't use an AI. But I want your advice. Comment below. Should I go and pick up this AI at the pharmacy? Because the doctor's already sent in the prescription. Do you think, based on where my testosterone level is, do you think that I should get on the AI? I feel good, but I mean, am I going to feel better if it's a little lower? You guys tell me. Some of you in here know way more about this than I do. So, will you let me know? Will you help me out with this? I want your advice. A lot of you always ask me for advice. Now, I'm asking you. What should I do? Let me know in the comments. Now, let me mention something that you should do. You should go get your blood checked if you haven't yet. If you're having negative symptoms like depression or low energy or low libido or mood swings and things like that, you should go to the doctor and get your blood checked. However, if you don't want to go to the doctor and get your blood checked, you can use an at-home testosterone testing kit from Let's Get Checked. They offer professional and affordable at-home testosterone testing kits. However, they're not only testosterone testing kits, they offer a plethora of other testing kits as well. What's really cool about this kit is it comes right to your house. Prick your finger, you give the blood sample, you send it off, and you get the results back right on your phone. How cool is that? So go to their site and check them out. Also, they're having an extra sale on, usually I've only got a code for 20% off. Now they've got a code for 25% off. Right here is that code. Plug that in and you'll get that extra discount. Check them out, see if they're right for you. Hey guys, thanks so much for watching. I appreciate you. God bless. Peace.